Well, good morning everyone. Here we discuss few important points related to vitamins. Vitamin A deficiency causes the night blindness and it leads to the corneal degeneration and white or spot. It prevents the squamous metaplasia. Next is the vitamin B1. Vitamin B1 seen in the alcoholic patient and it leads to the Wernicke-Korsakoff syndrome. Deficiency signs and symptoms shown with patient is confusion, ophthalmoplegia, and ataxia. Ataxia is an involuntary movements of the hands. Dry beriberi is another disease. It leads to the peripheral neuropathy and symmetrical muscle wasting. Next is the wet beriberi. It increases the cardiac output failure. It leads to the increased cardiac output failure, causing the dilated cardiomyopathy. Next is the vitamin B2. B2 another name is riboflavin. Two C's it represent, and two C's are just scoliosis and corneal vascularization. Next is vitamin B3 niacin. Niacin leads to the Hutton disease and pellagra 3Ds. 3Ds is a diarrhea, dementia, and dermatitis. Collar rash like necklace scene, and it is also used to treat the dyslipidemia. Next is vitamin B5. Vitamin B5 pentothenic acid, and it, it leads to the dermatitis and alopecia. As you know, alopecia areata is seen like a exclamation mark in the man. Another MCQs. Next is vitamin B6 pyridoxine, another name, and causes the peripheral neuropathy, convulsions, sideroblastic anemia. Next is vitamin B9 folate, and folate deficiency, as you know, folate deficiency lead to the neural tube defects. So for prevent this side effects, we given the pregnant patient given in the pregnancy in first trimester. In first second trimester, in the morning, we mostly prefer to give the folic acid, and it is present in the leafy green vegetable and absorbed in the jejunum. And so if they decrease, deficiency seen in most probably in the pregnancy and in alcohol, and it also causes the macrocytic megaloblastic anemia. Next is the vitamin B12 is another name is cobalamin, found in animal products. Large reservoir pole is the liver, and it also leads to the megaloblastic anemia, macrocytic megaloblastic anemia. MCV is raised in both the cases. Next is vitamin C. Another name is ascorbic acid, and it is a good antioxidant, facilitate the iron absorption. Why it leads to the scurvy? Because due to the collagen synthesis defect happen due to the proline and lysine. Next, proline and lysine hydroxylation is not good, so the synthesis of the collagen defect leads to the scurvy, and it's seen in the vitamin C. Last one is vitamin D, 25 hydroxy D3. It is in the storage form. You always take it is a storage form when you have an option 1 comma 25 dihydroxy D3 calcitriol. It is always mean that it is in the active form. So last one is rickets, always seen in the children, like as you know the bowing legs seen in the children, and osteoporosis seen in the adult, and osteomalacia mean the softening of the bone. It all due to the vitamin D deficiency, and you can also fulfill this deficiency by taking the sunlight by with the natural resources. So goodbye, that's it.